Every day, clinical physicians diagnose, treat, and care for patients, often under pressure, often with limited time. Most of the time, clinical medicine works exactly as it should, but sometimes a patient doesn't fit the textbook, the fever that doesn't resolve, the infection that keeps coming back, the anxiety that appears after a disaster, the illness shaped by where a person lives, works, or what they're exposed to. At its core, One Health is a collaborative and practical approach that recognizes the profound, interconnected relationship between the health of people, the health of animals, and the integrity of our shared environment. It acknowledges that we cannot effectively protect human health without also considering the well-being of the ecosystems and animal populations we live alongside. For you, the clinician, One Health is not a separate, burdensome discipline to master. Instead, think of it as a powerful extension of your existing clinical reasoning, a way to broaden your diagnostic lens. It prompts us to ask, what else could be at play here? This framework reminds us that a patient's illness may be influenced by a wider range of factors, such as direct or indirect animal exposure, from household pets to livestock and wildlife, environmental conditions, like changes in water quality or air pollution, occupational risks for those in agriculture, sanitation, or animal care, and the growing impact of climate change and natural disasters on disease patterns. One Health does not replace the fundamentals of clinical medicine. It strengthens it, providing crucial context and new avenues for diagnosis and management, especially when you're faced with complex, atypical, or recurring cases that don't fit the textbook presentation. It's about thinking bigger to provide better care. Clinical physicians are on the front lines, often the first point of contact when a One Health issue emerges from the community and walks into the exam room. These moments demand a broader perspective, a deeper inquiry into the patient's world. Consider a patient presenting with fever after recent flooding. Is it a common virus, or could it be leptospirosis from contaminated water exposure? Or a child who develops persistent anxiety after a hurricane? This isn't just a behavioral issue. It's a direct health impact of a climate disaster, requiring specific screening and support. An elderly patient collapses during a heat wave. Beyond immediate rehydration, we must consider their living conditions and social support to prevent recurrence. An infection becomes resistant to standard antibiotics, a growing crisis linked to use in both human and animal health. These are not abstract environmental problems happening elsewhere. They are tangible clinical problems seen every day in clinics and hospitals, especially in the Caribbean, a region uniquely vulnerable to these interconnected threats. The One Health framework equips clinicians to practice better medicine. It encourages us to ask, what else might be contributing to this illness? What environmental, animal, or social factors are part of this patient's story? Answering these questions leads to a more accurate diagnosis, effective treatment, and a healthier community. One Health thinking is most useful when a case is complex, atypical, recurrent, poorly responsive to treatment, linked to exposure, disaster, or community clusters. When the usual approach is not enough, One Health helps clinicians broaden the clinical lens without losing scientific rigor. Integrating the One Health approach into your daily clinical practice is a powerful way to enhance diagnostic accuracy and improve patient outcomes. It's a straightforward, four-step process that begins with a simple but crucial shift in how you gather patient information, allowing you to see the bigger picture behind your patient's symptoms. Step 1 is to expand the patient's history beyond traditional questions. Think like a detective. Ask specifically about their interactions with the world around them. This includes direct and indirect contact with domestic animals, livestock, or wildlife. Inquire about environmental exposures, such as recent travel, recreational water activities, or proximity to industrial sites. Consider their occupation and any unique risks it might entail. And always ask about recent community-wide events like flooding, heat waves, or other disasters, as well as any similar illnesses spreading through their family or community. Step 2. Broaden your differential diagnosis. With this expanded history, you can now consider a wider range of possibilities. Could this be a zoonotic disease passed from animals, an illness caused by an environmental toxin, or a condition exacerbated by climate change? Step 3. Adjust your management plan. Order targeted investigations based on your new hypotheses. Refer to specialists early when a case seems unusual, and always apply antimicrobial stewardship to combat resistance. Finally, step 4. Collaborate. Your role is part of a larger network. Engaging with public health, environmental health, mental health, and veterinary services is key to not only treating your patient, but also protecting the entire community. A febrile illness after flooding points to environmental exposure. A respiratory illness in a poultry worker suggests zoonotic risk. A cluster of diarrheal illness raises concern for water contamination. Post-disaster anxiety reflects community trauma. Each example shows how One Health sharpens diagnosis and improves outcomes. One Health is not only about diagnosis, it is about prevention. Clinical physicians play a key role in risk counseling, food and water safety education, heat, illness, prevention, disaster, preparedness, mental health support. By addressing upstream factors, clinicians protect not only individual patients, but families and communities. In the Caribbean, climate events, zoonotic diseases, and environmental exposures are not rare. They are realities. One Health aligns naturally with family medicine, general practice, and hospital care, where clinicians already consider social and environmental context. One Health is not extra work, it is better clinical thinking. When clinicians understand the connections between people, animals, and the environment, care becomes more accurate, more preventive, and more compassionate. Because health does not exist in isolation, and neither should clinical care.